We know the numbers are the numbers. They seem to be checking out, unfortunately, or in some cases, you know, they're on the low side, which we're very happy. We want to keep them on the very low side, and that's where we're headed. And I think that's maybe where we're headed. But I'd like to ask maybe you and Tony, where is the week or the number of days of greatest attack? What will be our worst day, if that's possible to determine? I think that's what you're.
So as you can look in the places that are the most difficult hit right now, the Detroit area, the New York area, the Louisiana area, and we are doing it by the counties in those states because there are, mostly it's metro areas and the bedroom communities around those metro areas because people went to work and got exposed and came home and exposed other. If you look out in New York now, you see that it's in Long Island and it's out in Suffolk County and Nassau County. All of those counties, Wayne and Oakland, they're all on the upside of their curve of mortality. So you know when you get to the peak, you come down the other side.
And when will that peak be?
So by the predictions that are in that healthdata.org, they're predicting in those three hotspots, all of them hitting together in the next 6 to 7 days.
And are you thinking tens of thousands of deaths in that period of time?
You can go to the website. It's variable. Each one of those communities is different, but you know where New York is, how much their mortality has been, and you know what we're seeing today are the people who were infected 2 or 3 weeks ago. If mitigation in New York worked, and we believe it is working, the cases are going to start to go down, but the mortality will be a lag behind that because of the comorbidities and other conditions. So that's why all of the predictions are that this next week, and I think we said this last Sunday when we talked about the charts, and it's difficult to do, and we tried to prepare the American people to understand that you have to, as much as you go up, you have to come down the other side because coming down is a reflection of the cases that were coming in before.
Would you rather not say a number?
I'd rather not say a number, but the numbers are available if you go to the website. I mean, you can see that there's several hundreds per day in New York. And I think Governor Cuomo has talked about that increasing still into the 500, 600, 700 range a day. So, you know, that's very concerning to us. We, again, applaud the healthcare workers who are doing every single thing humanly possible to save more lives. And we are ensuring on a ventilator by ventilator, day by day, to get them there so that we can say and we can be there when they need it. Because we are supposed to be that group that comes in after all of the resources are exhausted. And we really applaud what Oregon did. And we really applaud what the governor is doing about moving between the states, between the different counties to bring them to New York. Because that's what's needed today. A different place will be needed tomorrow.
You mentioned, just to follow up on something apparently you said yesterday, that you had some concerns about Pennsylvania, Colorado, and Washington, D.C. Could you expand on that?
We're watching them because they are starting to go on that upside of the curve. We're hoping and believing that if people mitigate strongly, the work that they did over the last 2 weeks will blunt that curve and they won't have the same upward slope and peak that New York, New Jersey, Connecticut, and part of Rhode Island are having. So this is a very important, the next 2 weeks are extraordinarily important, and that's why I think you've heard from Dr. Fauci, from myself, from the president and the vice president, that this is the moment to do everything that you can on the presidential guidelines. This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe. And that means everybody doing the 6 feet distancing, washing your hands.
So, I mean, ditto to everything that Dr. Birx said, but also to emphasize why it's so important to do that, because we're looking at 3 or 4 really key hotspots that are still going up. it's absolutely essential that the ones that are down at that lower level that Dr. Birx showed the other day, those communities where they're still going up, we've got to make sure we don't have multiple waves of peaks. That's going to be the answer to the question of when we can start pulling back. Because if you keep having multiple peaks and different waves, that's going to make it very difficult. We put your foot on the, no, exactly what I said just before, and I keep repeating. Just make sure everybody does at least the minimal amount of that physical separation. Because the virus has no place to go if you're physically separated.
And one of the reasons that I keep talking about hydroxychloroquine is that the question that nobody ever asks, and the question that I most hate the answer to, is what happens if you do have a ventilator?